Today I'll be discussing about vaginal discharge, what is considered normal and what is not normal. So bringing back the normal physiology to you. Number 1, vagina is a self-cleansing organ. It has very small microorganisms known as lactobacilli in its epithelial lining. These lactobacilli maintain the normal pH of the vagina and produce some kind of discharge which is totally normal. Number 2, every month one ovum is released from the ovaries in anticipation of pregnancy. So to make the environment of vagina more receptible for the sperms so that they can crawl up and reach till the fallopian tubes, a smooth vaginal discharge is produced. So now, what are the characteristics of this vaginal discharge? This is transparent, it has no smell, it has no color, it is clear in consistency, it is not associated with itching. So when is it produced? It is produced just before the ovulation, during ovulation, and a few days after the ovulation. This discharge is considered normal. So if you are experiencing some amount of vaginal discharge during your cycle, it is normal. So now what is abnormal? What are the signs of concerns that you should visit your nearest gynecologist? Number 1, if you are having excessive vaginal discharge, by which I mean you are changing multiple times your undergarments in a day. Number 2, vaginal discharge has some texture, like it can be curdy white or cottage cheese like appearance. Number 3, it has smell. It can be fishy odor or some pungent odor or foul smelling odor. Number 4, it is associated with vaginal itching and uneasiness down there. Number 5, this abnormal vaginal discharge can have color. It can be green in color, yellow in color, or curdy white. So if you are experiencing these kinds of symptoms, then your discharge is not normal. I would advise you go to your nearest gynecologist so that she can do a gentle PV examination and rule out any sort of infection. Now, how can we prevent this abnormal vaginal discharge? These are few very basic and easy things which we all can do. Number 1, always wear cotton undergarments. You should avoid lacy or synthetic or silk undergarments because your vagina also needs to breathe. Number 2, as I had already told in the beginning of the video, that vagina is self-cleansing. So you don't need to use any kind of fancy scented soaps or vaginal douching to clean your vagina. Just normal tap water is fine. It is sufficient. Number 3, and most important, which we usually neglect, whenever you go for any sort of hair removal therapy like Brazilian waxing or creams, etc., then you must ensure that your care provider is properly sanitizing her hands, is using sterile surgical gloves, is using clean equipments, and the wax which is being used is fresh so that cross contamination is prevented from one person to another. The important point is you should always use barrier contraception condoms if you have multiple sexual partners. So you should always visit your nearest gynecologist to get yourself examined. This vaginal discharge which is abnormal is totally treatable. Mostly it is caused due to cervicitis or vaginitis or infections like candidiasis, trichomonas. All these infections are curable.